losing a child or a loved one, there is nothing worse for a family.
As BC grapples with the overdose crisis, a public health order has been issued, allowing registered nurses and psychiatric nurses to prescribe safe alternatives to toxic street drugs.
People who have heart attacks, they get instant care. They get the best drugs on the planet. So why would we not give that same care to people with substance use disorder?
Pender Island's Leslie McBain welcomes the new health order. Her son, Jordan Miller, died in 2014 of a pharmaceutical drug overdose. After the death of her only child, McBain began advocating for policies that support the lives of people who use drugs.
Nurses have always been allies. Nurses get it. They understand the problem. They see the people. They as a group, and in generally speaking, we've always had huge confidence in the ability of nurses to handle a lot of these problems that come their way.
While McBain is happy to hear about the new order, she still has many questions.
I think one critical issue is when. I'd like to know what drugs will be available to people. I'd like to know, for instance, how many access points there will be for people who use drugs. All these things that actually we don't know yet, which will make this a success or not a success.
The new policy has not yet been finalized, but the province expects it to be released as soon as possible. The BC Nurses Union is calling it a good first step.
We have been calling on the government to look at different ways to provide supports for people who are using substances. And unfortunately, for many nurses, their only option has been able to provide naloxone when people have overdosed.
But the BC Nurses Union also has its own questions about the new policy.
I would like to know how many nurses will be involved in this. I do understand that the BC Centre for Substance Use will be involved in the training, but I would like to know more about the curriculum, how long that will be, and how widespread will this happen.
Currently, only doctors and nurse practitioners are able to prescribe safer alternatives to toxic street drugs.
It affects so many people across Canada. We've had almost 16,000 deaths from drug toxicity or drug overdose, and that's 16,000 families who will never be the same.
In Richmond, Miranda Fatour, City News.